Hey YouTube friends, I'm going to cover with you today the top 3 back arthritis exercises that you can do at home. Now, people that have back arthritis, they typically are very stiff in the morning. They have, it takes them about 20 minutes, 30 minutes, sometimes even up to an hour or more to just move better. They get up real stiff in the morning and they walk slowly to the bathroom, get their clothes on, do all their morning routine. And it's usually several minutes, if not an hour or more, before they feel kind of decent after that. If that's your experience and you might have back arthritis, or maybe you've already been told, you've been diagnosed by a doctor, through x-rays or an MRI, you've been told that you have back arthritis, then these exercises are going to be very helpful for you right now. Real quick, just a bit about me. My name is Dr. David. I'm a specialist physical therapist at Paso Manual Physical Therapy, and I've been helping out people with back problems for years. Back arthritis is one of the most common things that we see here, and specifically with back arthritis, the joints have changed a bit inside the back. There's at every level of the spine, in the lumbar, is the lower back. There's 3 joints. The disc is one, where the disc connects one bone to the next bone, but then you have something called facet joints on the back of the spine, and that's where we're talking about the arthritis occurs. So you may have been told you have facet arthritis. That's the kind of arthritis that we're talking about here. Now, just to be a little more specific, there's different kinds of arthritis. There's, of course, osteoarthritis is the most common, and that's what I'm looking at addressing here. Psoriatic arthritis or rheumatoid arthritis are 2 other common ones. We're not talking about that. That's a different condition. But the age-related arthritis that most people talk about, which is osteoarthritis, that's what these exercises are going to help you out with. So let me get into the top 3 exercises. The very first exercise that I'm going to discuss here is a knees to chest exercise. So I'm going to have my partner here demonstrate that. So go ahead and bring your knees to your chest. You're going to wrap your hands around your knees and just hold it there as tightly as you can without hurting anything or squashing yourself too much, but you should be firm in your grip here. And you'll hang out there anywhere from 10 seconds to 30 or maybe even a minute. And I would do this 3 or 4 times right before you get up in the morning. You can do this any other time throughout the day if you feel like you need it. The point of this is to just open up the joints in the low back, get the joints that are stuck where the arthritis is to free up and move, and that begins to loosen things up. This is kind of a stretch. It's not really an exercise, but it is a little bit of effort from your arms and your legs, just a bit, to get those joints to open up. Now, if you have trouble bringing your legs up in this position, there's an alternate position for this exercise. You can lie on your side. Let's have you demonstrate that here. Just make sure your legs are resting against the bed or the floor, wherever you're doing this, and just pull those knees in. You might do it one-handed, or if you can sneak in both hands, you can do it that way too, and just hang out there. And what you're trying to do in the low back is to curve it out. Not curve it in towards your belly button, but kind of go opposite towards the belly button. For him here, he'd have to be going up against the wall. His back should be pointing up against the wall. So let me cover with you the second exercise. Let's get you on your hands and knees here, please. This one you'll do in your bed or on the floor, wherever you find comfortable. It's called an angry cat exercise. It's a yoga type exercise, actually. It's really good. What you're going to do is, with your lower back, go ahead and arc your back up as high as you can. This will round out up here, that's okay. But your target is to round out the lowest part of your back here, right where you get that stiffness and that arthritis problem, and hold it there for 10, 20 seconds or more if you can. And what I would do is 10 repetitions. Just relax after a while, go ahead and relax. And then when you're ready, go up again and just get a stretch to occur here. But what you'll realize, the harder you push through here, you're gonna feel some muscles working in here and back here on the glutes. So between the abs and the glutes, they should be activating to get you to move in the right direction in your lower back here. So same thing, do this in the morning, and then you can do this as needed throughout the day. Let's talk about the third exercise. This is a mini crunch. So let's get you on your back here with your knees bent, please. For this one, you'll be in this position, and this one takes the most effort of the 3. What you're gonna do is, I'm gonna slide my hand under his back here, and if you do that with your hand under your back, and what you're trying to do is smash the fingers back there with your back. So go ahead and push down here as hard as you can, and you'll see his shoulders and his head came up. that will likely happen with you. If you're pushing down hard enough there, you should feel your abs working pretty hard, and your head and shoulders will likely lift off the bed or the table, wherever you're at, the floor. If you have trouble with your neck or shoulders, you can slip a pillow under there, and that's fine. That'll be perfect. In fact, let me just show you what it'll look like. Here's a pillow. Go and pick up your head, and then go ahead and do the same thing. Push down as hard as you can. And I would hold this for 10 seconds or more if you can, and do this repeatedly in the morning. About 10 reps is a good amount to do it, just to get the muscles to activate and get the joints to open up in the back where the arthritis is. And then you can do this throughout the day. This is generally a pretty harmless exercise. Now, if you get pain or discomfort with any of these exercises, I encourage you to stop right away and talk to a healthcare professional. These exercises are places to start with fixing an arthritis problem. It's not going to fix it all the way 100%, but what I'm hoping to provide you with is a way to kickstart that process so that you're not relying on medications or having to get injections, or worse yet, eventually having to have some surgery done. Most of the time, like we see here in the clinic, we see people that recover and get back to normal. They don't necessarily lose the arthritis, but they get it under control so that it's not stopping them from bending over, and so they're not feeling so stiff in the morning. So these exercises are kind of step one in the process that it takes to get arthritis problems under control, so that it's not a big problem anymore, and it's a very manageable situation that most people can not even think about. They even forget that they've got arthritis in their back. Thanks so much for watching, YouTube friends. I hope that this video was helpful for you, and I hope that you give these a shot. If you did and they're benefiting you, leave a comment below. Let us know if it's working out for you. If you have a question about it or anything else related to back arthritis, drop a comment. I'm happy to hear it and get back to you as soon as we can. Also, if you thought that this was helpful, give us a like and scoot your cursor over just a bit more to hit that subscribe button so that you can get notified whenever we release more helpful tips that might benefit you. And another thing, if you're looking for more help with back issues, we've got an entire playlist of back videos that we've created over the years. If you go over to our channel at Paso Manual Physical Therapy, you'll find a playlist on there that's all about help for back problems. So go check that out. I look forward to seeing you soon. Bye-bye.